I started my day this morning at 5 o'clock London time, so I'm going on about 21 hours now. So if I get tang-tungled, you'll know why it is. I was in London, Wales actually. The BBC flew me over there for a week doing filming on welfare reform, where I go and talk to people about welfare issues and that type of thing. And we've got a film crew out there, and Britain's trying to do welfare reform. They're doing some things right, some things not right. But they had me over for a week. This is actually the second time we've done this. Did it a few years ago. And in fact, about a year and a half ago, they wanted me to come back and do one with them on the hospitals there in Wales, but the NHS would not give them permission to come in and film. So they couldn't do it. But I'll tell you, when I did this the first time, we go out and I talk to people on welfare. I talk to some doctors who had to approve it and so forth. And we're in the car headed out, and I'm with the film crew, and they hand me one of the prep sheets. I'm going to go talk to a man named Paul Peck. Paul Peck is a disabled man. He had a leg amputated. And so he's on benefits there, and I'm reading through this because it's giving me the background. And it tells a story there that several years before, he had been out at one of the fish and chips. These are Brits. So he'd been at one of the fish and chips, horsing around with a guy, fell down, broke his hip, went to the hospital, and they eventually amputated it. And I said, they amputated a broken hip? And the two people in the car, the producer and the videographer, in unison said, that's the NHS for you. So we went out to visit with Paul again to see how he is a few years on. He's still, of course, disabled, but now his left leg, the right leg was what was amputated, the left leg has got a huge area on the leg, and he raised the leg so they could film it. It looks, it's sort of red and purple and dark, about that long on his shin. And he says his doctor can't figure out what's wrong. He says he's on 9 pain medications for all the pain that he has, and they're trying to figure out what to do. That's the NHS for you. But I bring this up because when we were over by the hotel coming from a meeting we had attended on the living wage, we were walking down what's called Queen Street, which is an area where they have, it's a kind of a strip mall down there that they have blocked off, and people walk. It's a kind of a tourist area and place where a lot of the locals hang out, called Queen Street. And as we're walking up there, I see this big statue up here of a man standing up. He's kind of leaning over like this. And I said to the film crew, I said, who is that? They said, he's Aneurin Bevan, the founder of the NHS. They have a huge statue of him because he came from Wales. He was a member of Parliament, a member of the Labour Party, a very advocate of left-wing policies, and he founded the NHS between I think they passed it around 1946, and it goes into effect in 1948. And I thought to myself when I saw that huge statue up there, I wonder how many people have indirectly died from this man. He was a politician who founded it, and it also raised the question, I wonder if in 10 or 20 years we'll have a huge statue to Barack Obama or Kathleen Sebelius because the politicians are in control of it. So one of the things I did at night, we were gone most of the day. We started early, we went till late, and I got home, and Britain has a lot of papers. And so I picked up some of these, and this is just a smattering of 3 or 4 days when I had a chance to grab some of the papers there. I thought I'd let you see some of the headlines here. Cover up storm after 999 operator error delayed ambulance for dying asthma boy. The people that you called for that didn't respond quickly. A boy with asthma ends up dying because the ambulance doesn't get there quickly enough. Actually, I was listening on to the news as they were doing a story on the BBC about this, and they mentioned that a little while back a man died because it took the ambulance 2 hours to get to him. Did I mention that the ambulance system is run by the NHS? British Medical Association says GP surgeries, that's like their doctors' clinics there, are bursting at the seams and under-resourced. David Cameron, that would be the Conservative Prime Minister, has pledged to make it easier for patients to get an appointment and last month announced £50 million pilot program that will see more than 1,000 practices move to 7-day-a-week working system with appointments available from 8 a.m. to 8 p.m. Doctors are going to have to appear 7 days a week. But Dr. Nepal, chair of the BMA's General Practice Committee, said the government was, quote, making promises without having an honest discussion about the chronic under-resourcing and pressures faced by GPs, which make any major changes to work practices impossible without sustained investment. So you have a politician excuse me, announcing what they're going to do to fix the system, and the doctors say, you're not listening to us. Have we heard that anywhere in the last few years? Pay doctors extra to help the poor, say Lib Dems. The liberal Democrats are considering offering GPs financial incentives to practice in impoverished areas that have few doctor surgeries, that is, their clinics. The party is badly in need of populist policies to salvage its flagging general election prospects, and it is felt this move could prove a vote winner. Health is proving to be a major battleground in the long build-up to next year's national poll. GP leaders, general practitioners, claimed last week that 700,000 patients could lose their family doctor within months as nearly 100 cash-starved surgeries face closure as a result of funding reforms. If you like your doctor, you can keep him. Now, did you notice in this liberal Dem proposal, it says nothing about the patients. The reason they're proposing these changes is in order for them to have a populist, according to the paper, a populist political issue that they can go run on because they haven't gotten anything else. Special measures for hospital with long history of problems. A hospital where blunders and bullying going back years were exposed by the Mail on Sunday has been placed on special measures after a damning report by watchdogs. So the Daily Mail found out about this and ended up getting something done, not the politicians. The media had to do it. And this was my favorite one right here from the Sunday Times. I thought y'all would like this. Old should be denied cancer drugs. They've got people on NICE, that's their IPAB, saying we simply can no longer afford cancer drugs for older people. Therefore, we ought to stop giving them to older people and give them to young people instead. That's the National Health Service where politicians run the system. And we're getting pretty close ourselves. So and what you notice from this is they're not listening to the doctors, but they didn't listen to the doctors here either. I got an email from a doctor out of the blue, don't know him, about 3 months ago, complaining, saying, I just wanted to tell you that I'm a doctor. I've been practicing, I think, like 30 years. I've got a lot of friends. They have been practicing for years and years. He said none of the politicians came and talked to us about what needed to be done on health care reform when they passed that. And I wrote an email back saying, it's actually worse than you think. At least Barack Obama could say he didn't know where you lived. But he's got several members of Congress who are doctors, Tom Coburn, Michael Burgess, Tom Price. They didn't check with them either. It wasn't like they were hard to get in touch with. In fact, those people tried to give them some advice, and they refused to listen to it. Doctors were not, they just didn't pay any attention. And that got me thinking, if Democrats had taken some time to look at the difference between politicians and doctors, what differences they might have seen. Let me give you some. Number one, you have to know what you're doing. Politicians seldom know what they're doing. When you have a room full of doctors, you've got a room full of some of the most educated people in the world. You've got undergraduate degrees, you've got medical degrees, you were interns, residents, some of you did the MD, PhD perhaps, got the double degree at the same time. It takes you years to be able to do anything in the medical field. What does it take to be put in control of the most prosperous and powerful country in the world? You get elected. You don't have to know anything about this. Don't you find this amazing? I mean, it really is. All you have to do is go out there and run a campaign. And the politicians know nothing oftentimes about what they're doing. Now, Socrates addressed this years ago. 400 BC, Socrates raised the issue in the Republic, asking the question, why would you think that the skills it takes to win an election would necessarily translate into the skills it takes to run a country? And it's a good question. What does it take to be able to win an election? Well, you have to have lots of money or be able to raise some. You have to know people in power. You have to be charismatic. You have to sound persuasive. You don't even have to be competent. We can tell that from the people who get elected. All you have to do is be more competent than that other person you're running against. I mean, Barack Obama wasn't very competent, but he was running against John McCain. You know? And then Mitt Romney. So you don't have to know anything about it to be put in power to run the most prosperous country in the world. I'm amazed. And I don't know what the solution is. Socrates believed you should have philosopher kings. He wanted to train philosopher kings. The closest thing we probably had to that was Woodrow Wilson. Didn't work out. But it is amazing that you can become a politician, become elected, run the country, and never get to and never know what you're doing. So, we have the problem of the competent. How would it be if that's how we decided who practiced medicine? The people who won the elections. If the surgeons, I have a better way to do surgery, so if you vote for me, I'll be the new surgeon in town. We'd never do it like that, and yet we do it politically. But on the other hand, given the fact that so many doctors are retiring or fleeing Obamacare, it may not be long before that's the way we have to get our doctors. Number two, if you don't know, you ask. For politicians, it's don't know, don't tell. We have this issue of, when doctors are confronted with something, they don't know what to do here. They're not sure this is a little bit above what I've seen. I may not have seen this before. They'll often say, well, let me consult with a colleague to find out what the colleague thinks, and then I'll get back to you and we'll come, and I may bring the doctor to come see you. Politicians, especially senators, are supposed to know everything. When was the last time you talked to a politician and they said, I just don't even have a clue about that? And especially if you're talking to senators, they immediately go into a spiel about what they know, even if they don't know anything. Those of you who have gotten involved in some of this over the past few years as Obamacare was moving forward, I saw the emails from you as you were going out and starting to talk to the politicians. Let me see the hands. How many of you have gone and talked to elected officials about health care issues? A lot of you. Have you ever sat down with them and you start talking and their eyes glaze over? They have no idea what you're talking about. And they're the ones in charge, even as you're trying to explain it to them. They're able to reconstruct 1/6 of the economy and not have a clue as to what they're doing. I get calls from staffers all the time. I mentioned this, I think, a while back to y'all last time I was here. Back during the Clinton healthcare days, I got calls from the politicians who were thinking about reforming the healthcare system, and you'd be amazed at the kinds of things that they would ask. I got a call from a staffer who said to me, my boss has charged me with reforming the healthcare system. We're writing a reform of the healthcare system. True story. He said, do you mind if I ask you a question? I said, go right ahead. Can you tell me what a deductible is? True story. I get calls from staffers every now and then saying, my boss just said yesterday such and such and such and such. Is that correct? No. Can you tell me how we can change it around to fix it so he doesn't look stupid? No. He's already done that. But it was amazing how those of you who've gotten involved in talking to the politicians, and you go down and you visit with them, and you find out this person is in charge of this. If they know anything, it's usually wrong. And yet, they step up to try to change the healthcare system. Number 3, in the world of science, facts matter. In politics, facts are a nuisance. I'm a PhD, not an MD, but I did spend 10 years on the IRB, on human experimentation, at the University of Texas Southwestern Medical Center. So on the IRB there, all these research protocols are going on. You get very bright doctors here arguing back and forth about what's happening and so forth, but they're all trying to base their opinions upon evidence, things they've seen. We know this has happened, we've got these results and so forth. It's all based upon evidence, and you're trying to convince people based upon the scientific evidence if there's some disagreement about whether or not to pass that protocol. When was the last time you saw a politician who really cared about facts? What they want are things that justify what they believe. And you see it time and again. And have you ever seen an administration where facts are so irrelevant? I'm speechless to the things that we see there. You talk to them and you explain what happens, they don't listen, and they move on. They just can't be bothered with it. Those of you who talked to the politicians, you saw their eyes glide over, did they listen to you? Did they pay any attention at all? Did they care about the numbers or the statistics or the facts? They just oftentimes don't care. Here's my position. Give me the facts that will support that, and then I can move on. That's what I need from you. We, like I said, it's rampant. It's not just a healthcare thing. I did a piece here the other day on Earth Day saying the environmentalists ought to be really pleased right now. Temperatures have remained roughly steady for about 16 years. We've hit lows in tornadoes and hurricanes over a number of years. Ice is increasing in Antarctic and the Arctic. Energy-related, carbon-related emissions tied to energy plants have actually gone down to early 1990 levels. They ought to be pleased. And yet, the president turns around almost immediately here just the last couple of days and releases an environmental report saying, my gosh, this thing is going to hell. We're going to all die. Even though there's no facts out there supporting it. There just really isn't. I mean, we may see a global warming period pick up again, but we haven't for 16 years. And they don't seem to care about that. Number 4, in medicine, it's about serving others. For politicians, it's about serving themselves. When you're a doctor, when you're training to be a doctor, you are needy. You're going to people who are there, have the information and so forth, and you're going to them. You have to try to find out what you can get from those other people, and you learn from them, and then at one point you pass over that, you become a doctor, you get the experience, and then it's no longer about you, it's about others. So you transition from this thing of I need the help to where you are then becoming the helper. In politics, the process is reverse. As a candidate, they come around and say, what can I do for you? Once they get elected, they come around and say, let me tell you what you can do for me. And then they go out and hire people who they pay to tell them how great they are and write their press releases. And then they believe them. And decide they should probably run for president because of that. So you get a completely reverse of what you have between medicine and politics. Number 5, you are held accountable for your actions. You know where this is going. Politicians are almost never held accountable for their actions. Think of all the things we've heard, whether you're talking about health care, whether you're talking about the economy, whether you're talking about environment, whether you're talking about all the investments in green energy and so forth that were going to work out so well, all the jobs we were going to be creating, how everybody was going to keep their doctor. You hear you hear all of these things coming from the politicians telling you how great this is. It's not working out, and yet, they're almost never held accountable for it. The public almost never holds them accountable. About 90% of the politicians get reelected. In 2010, it dropped down to about 85% reelection rate. But in most years, it runs 90, 91% will get reelected. And it's not, I mean, we can blame the public for not doing this, but in fact, the politicians have gerrymandered the districts so that most of them are not competitive. So that if you're the Democratic nominee, you will get elected. If you're the Republican nominee, you will get elected. So that the real battle goes on among the nominees. But they have done that and now are largely not accountable to anybody. And unless you've really gotten caught in some kind of scandal, you almost never get forced out. Remember Bill Clinton and his scandal? And you know, it's interesting. They don't turn around and say, at least they're changing that some now, but in the past, not so much. Bill Clinton got caught with Monica Lewinsky, whose new book is out now. Did the Democrats come up and say, Bill, you know, I think this is over the top. You should probably resign. No, they stepped up and defended him. Obama has had his issues here. And the Democratic team turns around and defends him regardless of what he says. Pelosi's the same way, Reid's the same way. John Boehner, oftentimes, he gets a little more pushback than some others, but John Boehner's been defended. So the politicians seem to not be held accountable in most cases for what they do. And the way the districts are arranged, it's very hard to kick them out. Number 6, independent doctors have to balance their own books. Most politicians never balance the books. In fact, it has gotten so bad. Think about Medicare for a second. Prior to Obamacare, Medicare was about 90, from the Medicare trustees, long-term unfunded liability of Medicare Trust Fund, was around $90 trillion with a T. $90 trillion. Obamacare said we're only going to pay, that the Medicare trustees have to incorporate in their long-term predictions, we're only going to pay doctors about 29% of what insurance would pay for Medicare. And as a result, when the Medicare trustees look at this, they say, well, that's a big difference, and they adjust the long-term unfunded liabilities. Eventually, essentially just lopped out about $45 trillion of unfunded liabilities just by the law. Not because they did anything different, but because they said you have to assume this to the actuaries, which the Office of Chief Actuary, a guy named Richard Foster, ended up publishing, for the first time we've ever seen this, a separate assessment after the trustees came out with their assessment of the long-term unfunded liabilities. The Office of Chief Actuary came out and said, with a nicely worded phraseology, which essentially said, don't believe a thing it says. It says the Medicare trustees have to follow the law. And we don't really think that politicians will follow the law. We think they'll make some changes. So as a result, if you do that, they're going to have to raise taxes by this much and that much in order to be able to make the thing work. He did that about 3 years in a row. Then he retired. Wonder why that happened. I was wondering he made that. I thought it was amazing he made it that long. Social Security, is that balanced? You've got about $2.7 trillion that the government is supposed to have in an account that we have paid in, but it's borrowed all the money. And if you want to get in a squabble, talk to a liberal about whether or not that money's really in there. They will defend to the death the notion that that money is in there and available, even though the government has borrowed it all and spent it and taken credit for it. Lowered the books, so it made it look like the books were more balanced because they took that money and borrowed it, because the liability for it is actually off the books, and so it made it look like the things were more balanced. Then there's the federal debt. Going back to being held accountable, President Obama came in as a candidate criticizing George Bush for the amount of spending he did, and ended up increasing the federal debt by about $6 trillion, I think we are right now. Is it $7 trillion? And then his new budget has got, I think the CBO is estimating an extra, what, $5-6 trillion over that if that stays in. And he criticized Bush for the debt increasing by $1 trillion or so in his administration. $1 trillion. They get away with it. So if you're, and here's the difference. If you go out as a business person, as a doctor, and you have your office, you do well, you make a profit, you are greedy. If they come out and say, we really struggled and we lowered the federal deficit, or we lowered the rate of spending from here down to here, we're geniuses. Even though they can't balance anything. Well, there is at least one thing, I think, that doctors can learn from politicians. We've heard a lot about the direct pay model. Politicians have had that in effect for years. They call it a PAC. where you pay them directly. So, we've got this challenge between doctors who, with their education and their skills and their actions, are the most trusted profession in the country. Politicians are the least trusted profession in the country. Who gets to be in charge of health care reform? We give it to the least trusted profession in the country. And they come and say nothing to doctors. Which is why I think if we could make a big difference if you had people like AAPS doctors in charge of the government. That's where I'm going. If we were doing something like that, I think Dr. Eck is actually being a little cautious. I wouldn't put her in the presidency. But what if we had a department that did, instead of a press person, someone who was in charge of the department of answering stupid media questions? Would Jane be good for that? Who do we put in charge of the department of, if it ain't in the Constitution, we ain't doing it? And who would we put in charge of the department of, if we don't have the money, we ain't spending it? If we had you in there, we would turn this thing around in a hurry. So more of you ought to be thinking about doing what Dr. Eck is doing. Thank you.